Welcome, and thank you for joining us for this brief educational overview on supporting optimal well-being and metabolic health through hormone balance for both men and women. Today, we'll explore how hormone therapy is helping patients regain their vitality, improve daily functioning, and reduce many of the common symptoms associated with aging and hormonal imbalance. Bioidentical hormone replacement therapy, or BHRT, has been gaining popularity, especially when delivered through bioidentical pellets. This method offers a convenient, consistent, natural way to support hormone balance without the daily hassle of pills, creams, or patches. Pellets allow the body to receive hormones as needed, helping reduce symptoms and restore overall well-being with minimal maintenance. What exactly are hormones, and why are they important? Hormones are very important chemical messengers secreted from the endocrine glands directly into the blood and transported to organs and tissues of the body where they attach to receptors. These messengers work in a lock and key fashion to exert their functions, such as feelings of well-being, mental activities, sleep quality, weight management, energy levels, and libido. With age, hormone levels naturally decline. This decline can lead to a wide range of symptoms. If you experience fatigue, brain fog, low libido, or sleep issues on a regular basis, you're far from alone. And importantly, there's a reason you feel this way. Hormones naturally decline with age. Research shows that by age 40, women can lose up to 50% of their testosterone production, while men may experience up to a 40% decline. And the impact comes with real consequences.
I have been struggling with premenopause and menopause. I tried the natural way, tried all the natural ways for over a year. I worked with my gynecologist on different estrogels. Nothing was working. I couldn't sleep, couldn't focus. I'm in an industry where I need to be attentive all the time, fast moving, have high energy. So being in that industry, working around a lot of men and having hot flashes is not fun. So struggling with night sweats and hot flashes was probably the biggest part for me. And hot flashes happen from the toes all the way up. And you know it's coming and you're just trying to be really nice and be normal. And meanwhile, a little trickle of sweat's going down your face. My whole body got red where people are leaning over, "Are you okay?" And I'm like, "Yeah, I'm fine. Give me a minute. I'm over 40. When you have that kind of hot flash going through you, there's no way you can think normally when you wake up in the morning. There's no way that anything is normal. And I was moody. You're tired, and I'm not a tired person. Well, I'm here to say, I feel beyond great. Between being able to sleep at night, no night sweats, no day hot flashes, my sex life, amazing. Just being able to focus, getting your energy levels back. I literally, as soon as I started it, within 3 days, had no hot flashes. My body temperature was beyond normal. I have 2 kids that are in their 30s, and they are all like, "Mom, what's going on?" Because my energy level's back up, I'm organizing things, I'm going places, I'm multitasking without freaking out when I forget something. There's no way I could have said thank you enough for me getting my life back. And that's exactly what it did for me.
So ask yourself, how are you feeling? Are you drained, irritable, anxious, and mentally foggy, like you're just not operating at your best? Or do you feel energized, well-rested, emotionally connected, and fully present in your daily life? This contrast reflects the impact hormone balance can make. The symptoms of low hormones are real, and they're common in both men and women. Let's take a closer look. Common symptoms include low energy, concentration, and motivation, sleep disturbances, hot flashes or night sweats, and vaginal dryness in women, brain fog, mood changes, low libido, weight gain, and decreased sexual performance, many of which are difficult to manage without addressing the root cause. Most low hormone symptoms are traditionally addressed in 2 ways. We either try to manage them ourselves, reaching for energy drinks, weight loss medications, or sleep aids, or we visit a doctor. Too often, that visit results in a prescription that acts more like a Band-Aid than a true solution. When the root cause, hormone imbalance, is overlooked, one prescription can lead to another and then another, just to manage side effects. Doctors who aren't trained in hormone therapy may prescribe pain medication for fatigue or fibromyalgia, which can lead to drowsiness or dependence. Antidepressants for mood changes can result in sexual dysfunction and other negative effects. Sleeping pills for insomnia can worsen sleep apnea and leave patients groggy. And for men experiencing erectile dysfunction, a pill is often prescribed without addressing the real underlying issue. It's a cycle of symptom management that often leaves patients feeling stuck. Around 6,000 women enter menopause every day, and symptoms can begin in the late 20s. What's less widely known is that women naturally produce testosterone, and it plays a vital role in overall health. In fact, testosterone supports over 3,000 functions in the female body, influencing everything from mood and energy to bone density and mental clarity. Because hormone imbalance develops gradually, many women don't realize how much it's affecting them until the symptoms become difficult to ignore. Many continue to struggle without ever finding lasting relief. And hormone imbalance isn't just about feeling better, it's about protecting long-term health. While heart disease is more commonly associated with postmenopausal women, it still remains the leading cause of death in all adult women, including those under 55. According to the CDC and AHA data, 1 in 7 premenopausal women will die from heart disease, and after menopause, that number rises to 1 in 3. Both estrogen and testosterone have cardioprotective effects, helping maintain healthy cholesterol levels, blood vessel flexibility, and glucose metabolism. For men, hormonal decline is often referred to as andropause. In men, testosterone levels commonly drop from 1 to 3% a year starting in their 30s. And by age 50, about 1 in 5 men have clinically low testosterone levels. This decline isn't just about energy or libido. It's linked to a wide range of serious health conditions, including high blood pressure, type 2 diabetes, sleep apnea, and cardiovascular disease. Low testosterone has been identified as a contributing factor in early onset heart disease, and it's increasingly being recognized as a marker for broader metabolic dysfunction. Despite the clear connections, hormone imbalance in men often goes undiagnosed or untreated, leaving many to struggle with symptoms that could be improved significantly with proper hormone optimization. Estrogen also plays a critical role in both men and women. Estrogen contributes to over 400 functions in the body, including memory, bone density, mood regulation, skin elasticity, and even protection against colon cancer. While women produce more of it, men require small amounts for cognitive function, cardiovascular health, and joint support. Many external and internal factors can contribute to decreasing estrogen levels over time. Testosterone, as we've mentioned, is one of the most active and essential hormones in the body. Men begin losing 1 to 3% of their testosterone production each year, starting around age 30. Women between the ages of 20 and 40 can lose up to 50%. When testosterone levels drop, we may experience fatigue, depression, decreased sexual function, brain fog, and stubborn weight gain. In addition to symptom relief, testosterone has been shown to help protect against conditions like osteoporosis, Alzheimer's disease, cardiovascular issues, arthritis, and even some cancers. As we stated earlier, women require optimal levels of testosterone. Even small deficiencies can create big symptoms. Many of the leading causes of death in the U.S., including heart disease, diabetes, and certain cancers, are closely tied to hormone imbalance, particularly low testosterone. Optimized hormones can also assist in the protection and prevention of Alzheimer's disease, osteoporosis, arthritis, joint pain, heart disease, cancer, and more. When it comes to hormone therapy, one of the most important things to understand right away is the type of hormones being used, because it makes a big difference. There are 2 main types: bioidentical and synthetic. Bioidentical hormones are designed to be an exact match to the hormones your body naturally produces. That means your body recognizes them and responds to them more naturally. While synthetic hormones, on the other hand, are chemically different. They may mimic the effects of natural hormones, but don't have the same structure. Synthetic hormones are often associated with negative side effects and were used in older studies that raised concerns about hormone therapy risks. So before looking at the how, it's critical to first ask what kind of hormones are being used. We always recommend using bioidenticals over synthetic hormones. There are many ways to address hormonal imbalance. Some of the more common methods are pills, patches, creams, gels, and injections, which are commonly synthetic formulations, while hormone pellets are always bioidentical. Each method has its pros and cons, but not all offer the same level of effectiveness, consistency, safety, or ease. Pills, for example, often cause spikes and crashes in hormone levels and must be taken daily. They're also processed by the liver, which can lead to side effects such as nausea, headaches, breast tenderness, or even increased risk for certain cancers. Patches provide more stable hormone delivery than pills, but still fall short of the consistency pellets provide. Many patients experience skin irritation, uneven absorption, or the inconvenience of frequent changes. Creams and gels can be unpredictable. Patients often struggle with dosing accuracy, and there are risks of hormone transfer to children or pets through skin contact. They also require daily or twice-daily application. In addition to creams and gels, patches and pills aren't able to deliver the levels of hormone optimization that provide protection against underlying health conditions such as breast and prostate cancer, Alzheimer's, and osteoporosis. Testosterone injections are commonly used to boost testosterone, but they often create sharp peaks and valleys that surpass optimal levels, which can cause mood swings, energy crashes, and other unwanted side effects. Virtually all injectable testosterone is synthetic, and it's been linked to elevated cholesterol, liver toxicity, and cardiovascular risk. Bioidentical hormone pellets are tiny, custom compounded cylinders, about the size of a grain of rice, made from plant-derived hormones that are chemically identical to the ones your body naturally produces. Once inserted just under the skin, these pellets dissolve slowly over time, releasing a steady, consistent dose of hormone, mimicking the body's natural hormone secretion. This helps avoid the highs and lows that come with pills, creams, or injections, and supports more balanced, long-term symptom relief. Most hormone treatments like creams, gels, pills, and patches need to be used daily, while injections are done every week or two. With pellets, it's just one quick procedure every 3 to 6 months. That means no daily hassle and more consistent hormone levels, which is another big reason we prefer bioidentical pellet therapy. Graphically, you can see the difference. Other therapies create peaks and valleys. Pellet therapy, by contrast, offers smooth, sustained hormone levels that align more closely with the body's natural rhythm. Clinical research supports bioidentical pellet therapy not only for symptom relief, but also for long-term health benefits. Studies show improvements in bone density, cognitive function, and even reduced risk of age-related illness such as cancer and osteoporosis. With individualized dosing and a strong global safety record, bioidentical pellet therapy offers an effective, low-maintenance solution. Patients often say they feel like themselves again. They report improved energy, deeper sleep, sharper focus, increased libido, reduced joint pain, and a greater sense of emotional balance and motivation. Some even say that restoring hormonal balance has transformed their relationships, and in some cases, saved their marriages. So what's next? It starts with a simple blood test to assess your current hormone levels. From there, your provider will review your results and recommend a personalized treatment plan. Once your custom dose is determined, small pellets, about the size of a grain of rice, are placed just under the skin in a quick, painless, in-office procedure. No stitches, no downtime. In 4 to 6 weeks, labs are taken to ensure optimal hormone levels are achieved. Then, females typically return for their next dose in 3 to 4 months, and men in 5 to 6 months. If you've been told by another doctor not to pursue hormone therapy or pellets, you're not alone, and we understand the confusion. But there are 3 important things to know. First, many of those concerns come from the Women's Health Initiative (WHI) study, which made headlines years ago and still does. What's rarely explained is that the study used synthetic hormones in women who were already older and high risk, using outdated methods. It was not based on bioidentical hormones or modern pellet therapy. Second, most providers receive very little training in hormone optimization or BHRT during medical school or residency. Unless they've pursued additional education, they may not be up to date on current, evidence-based approaches to hormone health. Third, some worry that pellets are too strong or irreversible. But in reality, with a well-trained provider, pellet dosing is carefully personalized, and the slow, steady release often leads to fewer side effects, not more. For most patients, it's the most natural and consistent way to feel balanced. We believe in educating you fully so you can make an informed decision, not one based on outdated studies or limited understanding. Why do some patients report negative pellet experiences? It's a great question. If pellets are so effective, why do some people report negative experiences? The truth is, it usually has less to do with the pellets themselves and more to do with how the therapy is administered. First, negative experiences often come from working with an inexperienced or improperly trained provider. Pellet therapy is highly effective when done right, but it requires specific training and expertise to get the best results. Second, issues can stem from improper dosing or a lack of lab monitoring. Hormone optimization should always be personalized and backed by lab work, not guesswork. Third, sometimes there's simply a lack of communication or unrealistic expectations. Patients need to know what to expect, how their body might respond, and that it's a process, not a quick fix. And finally, temporary side effects like mild acne, bloating, or mood swings can happen as your body adjusts. These are usually short-lived but sometimes get mistaken for treatment failure. With the right provider, proper dosing, and ongoing support, these issues are rare, and most patients experience life-changing benefits with pellet therapy. Let's do a deeper dive into some of the studies we've already referenced. Studies show that pellet therapy may provide additional protection against diseases like Alzheimer's, cardiovascular disease, and certain cancers. For example, one study found that bioidentical pellet therapy led to an 8.3% annual increase in bone density, compared to 3.5% with patches and just 1 to 2% with oral estrogen. Research has also shown that women who use bioidentical testosterone are 50% less likely to develop Alzheimer's, whereas men with low testosterone are up to 3 times more likely to develop the disease. And when it comes to prostate health, studies have shown that higher testosterone levels do not increase prostate cancer risk. In fact, it's elevated estrogen in aging men that's more strongly linked to prostate issues. Cardiovascular health also improves. A study conducted by the American College of Cardiology found that men with coronary artery disease who received testosterone therapy had better heart outcomes and no increased risk of cardiovascular disease. Finally, when it comes to breast cancer, decades of research studies consistently show that synthetic hormones, not bioidentical ones, are the concern. Synthetic hormones have been linked to an increased risk of breast cancer and faster tumor growth. In contrast, bioidentical hormones match what the body naturally produces. This allows for proper cell signaling and helps reduce the risk of abnormal cell growth. We hope this overview has helped you better understand just how important hormone balance is, not only for how you feel today, but for your long-term health and well-being. With the right kind of hormones, bioidentical, not synthetic, the right delivery method, consistent, long-lasting pellets, and the right dose, personalized through lab work and expert care, Purepell pellet therapy offers a safe, effective path to feeling your best again. If you're ready to take the next step, we invite you to schedule a consultation with your certified Purepell provider. They'll review your symptoms, discuss your goals, and walk you through lab testing and treatment options, all customized to your needs. Contact your provider today.